Hi, welcome to Talks with Jane. I'm Jane at Monarch Wellness in Scottsdale. Today I have with me Dr. Zac Hildenbrand, and he's from C4 Labs. And he graciously agreed to come in and talk about terpenes. And so that's going to be our focus today. Terpenes are a wonderful part of the cannabis medicine that we use to heal. So, Zac?
Thank you very much for having me. It's a pleasure. So, again, talking in terpenes, terpenes is kind of like the next frontier of cannabis, and specifically cannabis medicine. We've heard a lot about the cannabinoids, obviously, THC, CBD, but the terpenes are not just the fragrance and aroma molecules that everyone associates them for. They actually are incredibly therapeutic. And cannabis is incredibly robust. It has 50 plus terpenes in there that we know of to date. And some of these smell like pine, and some of them smell like citrus and lavender. But it turns out that they're incredibly effective antimicrobial agents, incredibly powerful anti-inflammatory agents, and some of these have actually been shown to help regulate blood sugar, fat metabolism, and so really quite effective molecules.
So, a quick explanation that I sometimes give the novice cannabis user is if you have two strains and say they're hybrids or indicas and they're both 16% THC and maybe the same percentage of CBD, the terpenes are what is going to give it that unique subtlety.
Absolutely.
So I always say alpha-pinene is a great bronchodilator.
Yes, it is. Absolutely.
And, I know the basics, but because it's the new frontier, I think we have probably at least 5 more years of really diligent research to, hone it so the plant can do amazing things for you. Because if you have anxiety, but you also have fatigue, it seems counterintuitive that you can get a strain of marijuana that would help with both, but I'm sure it's possible.
It is possible. And we see, because of the terpene, it's why some folks who maybe try concentrates don't get as well-rounded an experience as they do maybe trying flower. These concentrates, a lot of times, because these terpenes are very volatile molecules, they will be volatilized and released, and you won't have those in the final product. Whereas in the flower, if it's been grown properly, cured properly, you will retain a lot of those terpenes. And so you hear people talk about a full spectrum experience. And so you're absolutely right. Strain A and strain B might have the same cannabinoid profile, but they'll have drastically different terpene profiles. And as a result, you'll get a different experience. You see people trying to kind of reverse engineer and take concentrates and then introduce the terpenes back in, but then they're in different proportions, and so it's certainly not as viable and therapeutic as just in its native state. And
I think the synergistic effect of cannabis is, and they also refer to it as the entourage effect. So you can't tear apart the cannabis plant and have it work effectively, in my opinion.
Right, I completely agree. That's why we see Marinol, for example, which is just pharmaceutical grade THC, totally synthetic. People are not doing well with it. They need those other elements in there to round out the experience.
Right, because the plant, in somebody's wisdom, was created to work properly. Another thing I see, and I find this with myself, if I'm trying to decide between two strains, I'm innately drawn to the scent that I feel that I need for my body.
Yep.
So the scope of the scents ranges from diesel to dog poop to flower to anything in between. Many times I have patients say, "Don't call me unless it's super skunky," And my other thought on terpenes is, when you start to grow a plant, if the seed that and you're working on producing a strain is not terpene rich, there's no way in my grasp of knowledge to enrich a genetic once you have it. So you have to choose the genetic that's terpene rich to start off.
Yeah, and a lot of people are tracking those terpene molecules and cultivating those genetics. You're precisely correct. And so they find these strains that are really, really terpene rich or have a specific molecule. You talked about alpha beta pinene. Those are wonderful molecules. I personally like eucalyptol. I love the scent of that.
Yeah.
It's very, very hard terpene to find. And so when people see things like that, then they say, okay, well, these are genetics that we want to cultivate further and maybe push the equilibrium to have more, express more of these wonderful molecules.
So there's a genetics lab for cannabis up in Boulder, and they do a lot of collecting up there. And I was at a symposium where one of the people that worked in the lab was showing how closely related, you know, all these strains are to Kushes and how it's all entwined. And so really what's making the difference for people is the terpenes.
Absolutely, and that's kind of like a new field of research that we've embarked on, looking at chemotyping. And what chemotyping, most people are familiar with genotyping, which is basically describing one's characteristics on a genetic level. Chemotyping is looking at the characteristics of a strain based on their cannabinoid and terpene profiles. And so what we see is that, you know, there's a couple of issues in the industry. One, you have some folks that are producing one strain of cannabis and naming it 10 different things to say they have more variety. You also have people where I could be growing Chem Dog. I give it to you. You have a dog named Fluffy. You call it Fluffy Dog 4, and then you give it to a friend, and now it's, you know, Fluffy Ice 8. And there's the nomenclature is all over the place. So to combat that, we need to go back and look at the analytical data, look at the terpene profiles, and say, yeah, actually, this product is exactly the same despite the different nomenclature. And then we can actually trace, okay, is this a sativa? Is this an indica? Because that's another thing. You have, okay, sativa, indica, you're making these general recommendations, when in actually you should be making recommendations based on the chemical data itself.
Right. Yeah. And so Blue Dream to me is the workhorse of the industry, because Blue Dream is a very safe strain for the beginner. It's a very good strain. It's high in alpha pinene. It's got this great lavender scent. But you can go to 8 different dispensaries and see 8 different quote Blue Dream.
Absolutely.
So I personally let my nose tell me. So if I don't get that lavender scent, I'm like, I'll pass on that.
Absolutely.
You know, and if you have a Kush and it doesn't smell cushy to me, I'm going to pass on that one. And that's why it's so important that dispensaries have fresh samples put out and people can actually see, you know, what's going to work for them.
Yeah, and the amazing thing is that these terpene molecules, because they're so volatile and aromatic, they might be in the strain of interest, Blue Dream, at parts per billion level. I mean, so that lavender smell, that's going to be attributed to the terpene lanolol. Okay, and so you're finding lanolol at a very, very, very small amount. You're talking, you know, 0.01% weight by weight, and yet that is going to be a distinguishing factor for you in identifying that strain. It's incredible, and so people are just starting to clue into these things now, and I think it's going to be very exciting moving forward.
Yeah, and you know, cannabis is ever changing, ever growing.
Absolutely.
You can't get bored if you're in the cannabis industry. If you're a cannabis consumer, there's something new to explore and learn every day. I always tell new patients, journal, pay attention to what's happening to you when you medicate, and explore. Because, like, I've been different places, and I've had strains that I thought I was Albert Einstein, and just the creativity was just flowing. And when you can find something like that, you don't find something like that by staying in a safe little box.
Sure.
You know, you need to do your due diligence and explore and see what works for you. So I always prefer to buy in small quantities, take it home, see how I like it, and then go back and really you know, get what I need.
Absolutely. I mean, the consumer needs to not only experience that and make those qualitative observations, but I think that now with the market here in Arizona, we have, you know, testing that's readily available. You know, you can ask for that analytical data, and you can say, I had a great experience here. you know, oh, it looks like we had exofenchol was the major terpene here. Maybe I'm going to be looking for cannabis with that particular terpene. So you can get as scientific as you want with this. That's the beauty of cannabis. All those cannabis enthusiasts, canna nerds, as people refer to themselves. You know, this is just a wonderful time to be, you know, in cannabis, because there's just so much to be learned.
Yeah, and I have like a muscle memory connection with strains. So the first time I try a strain, I always remember my environment, the purpose, the intent, what was going on in my life. And, you know, you don't have to get too crazy, but there is a strain for each kind of occasion. You know, if you need to medicate and you're doing this or doing that, you get to the point where, oh, this will be the best strain for this occasion. So just because you're a Blue Dream lover doesn't mean that Blue Dream is going to meet all your needs throughout the day.
Absolutely.
And so I just encourage people to explore and enjoy and pay attention.
Yeah, that's absolutely right. And you're going to try new products, and not everyone's going to be a home run for you, but you make those observations, and then that helps you hone in your search.
Yeah. So we're running kind of long. I want to give you a chance to just give a parting statement about terpenes, and then we're going to close this one out.
All right, so again, this is Dr. Zac Hildenbrand with C4 Laboratories here, talking with Jane of Monarch about the incredibly class of compounds referred to as terpenes. They're not just scent and aroma molecules, they're actually incredibly therapeutic. And so when you are out there trying to make intelligent decisions about buying premium cannabis, you should ask for that analytical data to see what terpenes are there, what are, you know, the most prevalent terpenes, and that will certainly help you have a much more well-rounded and effective experience.
And I'm Jane. I'm head of patient services at Monarch Dispensary in Scottsdale. I can be reached at jfix@monarchaz.org, and also you can call our main line, which is 480-991-3752, and that'll do it for Talks with Jane. Thank you.